Hello, this is Dr. Latasha McElwain coming to you with an overview of the 12 core functions in the 46 global criteria. This is for substance abuse counseling and substance abuse case management. This is one of the core functions. This is the 12 core functions that typically, when you are coming into the substance abuse arena as a counselor and as a case manager, these are some of the basics that you are wanting to be able to go through when you're working with a client, a patient, consumer. I always share that in North Carolina, the 12 core function and the 46 global criteria is what we actually had to do as our oral boards back in 2008 when I got my LCAS, my full LCAS. We had to do this based on a case that we worked on. So basically, we had to take a case all the way from screening, intake, orientate, all through the entire process. And this gives us a great idea of all the things that you would do in a complete case. So you would go all the way from screening, and the last part would be consulting with other professionals in regards to the client's treatment services as we're completing the case and closing the case out. So I'm going to start just with this overview and just talk a little bit about each area and kind of give some little tidbits here and there. In our oral boards here in North Carolina, all of the highlighted bold word, well, not highlighted, but the bold words that you see here, those were all what they called buzzwords when we did our oral boards. And when you did your oral boards, based on all these buzzwords, you got a score upon based upon all the words that you actually used leading up. I've never counted them to make sure it was 100 words or not. I scored a 97 on my oral boards, so I think I did a pretty good job of meeting with a seasoned clinician that was a supervisor that could train me in this area. I ended up buying a little recorder where I could record myself and actually present my case. I had my full case study ready and set up to be recorded and for me to listen to over and over again, so I could really, have all of my case information down pat. If there were any questions, then I could answer questions in regard to these cases also. So I did an amazing job. Like I said, I made a 97, but it was a long process of getting myself to that point of being ready to present something in an oral board setting. It kind of reminded me of when I went to do my dissertation, except there wasn't as many questions for me to when I defended my dissertation as it was for this right here, because for this oral board, I guess I was pretty much on point with everything, and there were really no questions to be asked. So I didn't get any questions. I think at the end of my oral boards, I may have, I'm not sure, but I was able to answer everything specifically and clearly, and had a real great time in that experience and getting all that taken care of. So with that, I'm gonna go through the 12 core functions with the 46 global criteria and give some examples here and there. So when you first get a phone call about an individual with substance abuse concerns or need of substance abuse case management, they're being kind of referred into you. So at that point, you're going to start the process of determining whether the client is appropriate and eligible for services to that particular program that you're working in. So a lot of times you're trying to make sure that you're going to go through those global criteria and you're going to be able to evaluate them psychologically, socially, uh, physiologically, and have those signs and symptoms there of the alcohol or other drug use or abuse. I always just try to tell everyone when someone comes in for an alcohol assessment or, coming in for services, sometimes it's just use and they have gotten caught out there using or drunk at some point in time, whatever the case may be. And it could possibly be a whole lot of abuse. So you definitely want to be mindful of that. You want to know your 12 core, along with your 12 core functions and your global criteria, you're going to want to know what your diagnoses are. You want to know what the signs and symptoms are, but you want to know what the diagnosis, what do they meet for? A moderate substance use, or a mild alcohol use, or are they, severe? So you want to know, you want to be able to determine that, or at least have enough information that can lead up to where that person's technically appropriate for your program, eligible for the services and appropriate for the program. So again, you're gonna determine the client's appropriateness for the referral or for the admission, and that would be all the things that you need to know in order to make sure that client is appropriate for your program. It could be insurance information. It could be the demographics of where they're from, and whether you got a center in your area, someone, a area that's closer to their home or something. It could be a lot of different things when we talk about appropriateness of care. But one of the big things we talk about appropriateness of care is whether that person is able to maintain in that particular program. Is it going to be a inpatient program? Are they able to maintain in a full, are they going to be able, I'm sorry, are they going to be able to maintain in a full inpatient overnight program? Some people might say no, even though they've been referred to you, or they're coming in for their intake. Outpatient, are they going to be able to come every day for the outpatient days that are set up for the program? Some might say no, because they can't come every single day for the outpatient program. If it's going to be intensive outpatient, can you stay 3 hours, 3 days a week? Some people might say no. So there's a lot of things to think about when we talk about the appropriateness of the program. They may have a family member in the program already, so they would not be appropriate to be in the program. All right. The next one is determine the eligibility for admissions and or the referral. And the eligibility would be the eligibility for our program. Whatever our program says, if that person, is dealing with this, that, and the other, oh, they could be this right here, but oh, we have a whole component in there, our program that's kind of with children or a school or something like that, they can't be a sex offender. Just different things. Like, I'm just throwing those things out there. That's not necessarily what happens, but eligibility is whether they meet the eligibility criteria to be in our program. The next thing would be identifying any coexisting conditions. That's like medical, psychiatric, physical, anything that's going on with them that, indicate that they need additional professional assessment and services. So basically, if they got some other stuff going on, they're on a lot of medication. They're maybe doing methadone, and we don't take people that's doing methadone, the methadone clinic, or we take them on a case by case basis. So we got to get more information to make sure they're in a wheelchair, and our building, most of the time, most buildings are wheelchair accessible. But if our building wasn't wheelchair accessible, but we know there's one down the street, we would have to just talk to them and see if that's something that's going to be for them. But that wouldn't rule them out that they can't come to our program if that's what they want to do. And if we, have to go and make that extra step as far as getting them into our program, then we do what we do. But definitely coexisting stuff. What is going on with the individual physically? What's happening? Do they have diabetes? Do they have high blood pressure? Can they fall out from a seizure in our program? I mean, just different things like that. So I'm using those as examples. Those are not, the best examples, but yes, those are some examples of things that's just popping in my head because I'm doing all this from memory, of course. They adhere to the applicable laws, regulations, and the agency's policy governing alcohol and other drug abuse agent services. So basically, they're adhering to our program and what our laws are. So basically, we're giving them a rundown of this is what we expect, this is what we're looking for, blah, 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 blah. So we're giving them all that information to make sure that they're able to, be a successful candidate in our program and complete, hopefully, successfully. So with that, we get to intake. When we get to intake, we're talking about the administrative and initial assessment procedures for admissions to the program. So that goes into a little bit more deeper detail. And when I say deeper detail, pretty much the global criteria is there is to complete the required documents for admissions to the program, complete required documents for the program eligibility and appropriateness, and then obtain the appropriate signatures on the consents when soliciting from or providing information to outside services to protect clients' confidential confidentiality and rights. So basically, in that area, that's when you're kind of do the intake paperwork. And then most of the time we look at the intake paperwork, we're gonna get demographics. We're gonna get, who family members are. We're gonna get releases for those family members. We're gonna find out whether you have another a psychiatrist, whether you have a probation officer, whether you have someone you're working with, you have a case manager in the field. We want releases for all those individuals that we would be making contact with in order to get information on your behalf, in order to be share information so that we're able to work with them and they know what's going on, creating that team around that individual. Definitely going to make sure that there's the admission documents to the program. They understand what that means. They complete it, sign it, make sure the documentation is there. And then also making sure that they have all the program eligibilities and appropriateness. They definitely meet that, and that all that's documented as well. So documentation is real big in the intake department. So we really try to make sure that we get a lot of information there. The next part is orientation. So orientation is describing to the client the following. You're trying to tell them the nature and the goal of the program, what we're doing here and why we're here, the rules that govern client conduct and infractions that can lead to disciplinary action or discharge from the program. So they have to know that. You have to give them that information. It's a client's right to have that information. And then the other one is in a non-residential program, the hours in which services are available, treatment costs to be borne by the client, so the treatment costs that they're going to have to take care of, if there's any at all, and then also their client rights. So all this kind of plays into the client knowing what they're getting into and being agreeable to it. It is a client's choice to decide they want to come to our agency. It's our, duty to try to make that comfortable, that stay as comfortable as possible, as far as making sure that all of their rights are being honored. But like I tell everyone too, but we can't let you, sit in the lobby area and smoke cigarettes or whatever the case may be. We got to make sure that everyone's protected and taken care of. So global criteria with orientation, provide an overview to the client by describing the program goals and the objectives of the client, for client care. Then also provide an overview to the client by describing the program rules and the client's obligations and rights. And also provide an overview to the client of the program operations, when we open, when we close, when we don't accept nobody, when it's too late to come in, when the doors are locked and treatment group has started, you cannot get in the building, things of that nature. All right, gonna move on down here to the assessment area. In the assessment area, you'll see that the procedures by which the counselor/program identifies and evaluates an individual's strengths, weaknesses, problems, needs for the development of the treatment plan. So basically, this right here is when we start with the global criteria of gathering information, relevant history from the client, and this is including and not limited to alcohol or drugs use, appropriate interview techniques. So basically, we are going to provide, we're going to use interviewing techniques. Probably a lot of us use motivational interviewing to talk with a patient in regards to, what their history is like. Some clients come in and they have a lot of history to tell us, and some come in, they have very little history to tell us, which takes us back to previously when we did those releases, so we can get information, so we can know how to work with our clients. The next one here, 13, with the global criteria, is identifying methods and procedures for obtaining collaborative information from significant secondary sources regarding the client's alcohol and drug use and psychosocial history. So, like I said, sometimes they can come in and they don't have all the information for us. They're poor historians. And so we have to reach out to get more collateral information from family and from other resources, and figuring out what we can do as far as helping this person and making sure we have a full picture. Okay. Identifying appropriate assessment tools. We're going to identify the appropriate assessment tools we can use with the individuals. We're talking about those assessment tools. We're talking about, in substance abuse world, we have our SASSEs, we have our ASIMV, we have our, oh boy, I can't even think of some off the top of my head, but those are the two I can think of off the top of my head. the SALSI, different type of assessment tools that we will use to have the individual work on and complete. And it gives us kind of an overview of what's going on with that individual based on that assessment tool. So from there, we'll give them that, and then we'll explain to the client the rationale for the use of the assessment techniques in order to facilitate understanding. So we will definitely make sure they understand what we're doing, why we're doing, and everything to go along with that. So developing a diagnostic evaluation for the client's substance use and any coexisting conditions based on the results of the assessments, of all the assessments, in order to provide the integrated approach to treatment planning based on the client's strengths, weaknesses, and identifying problems and needs. So, with that being said, we are ready to formulate a diagnosis and when we are doing an assessment. And so I do tell everyone, when we are doing the assessment, we are getting all that information in order to take a snippet and kind of do like the clinical summary of what we've gotten to be able to give the justification as to why we are diagnosing this individual in this manner with these things and talking about what would be good for what would be beneficial for them, talking the strengths, the weaknesses of what's going on in their life, identifying those problems and those needs, but then also being able to recommend some things as well, which is totally appropriate when you're completing an assessment. um Next part is treatment planning. So treatment planning basically is the process in which the counselor and the client identify and pretty much rank the problems, needs, needing resolution, establish and agreed upon immediate and long-term goals, and then also deciding upon the treatment process and the resources to be utilized. So with that being said, we get down to global criteria 17. It would pretty much explain the assessment results to the client in a understandable manner. So I usually tell people that's in layman's terms. Talk to them and tell them what they told you, that this is why the assessment results are this, and kind of helping them understand where you are, where they are, and how all this is coming together and your understanding. I usually when I'm talking to them at the end of my assessment and I give them kind of the assessment results, I kind of go over that a little bit in that area too, just to make sure they understand what we're talking about and what we're doing. And then they feel comfortable with where we're going. And then we start the treatment planning from there. So 18 is talking about identifying and ranking problems based on the individual client's needs and the written treatment plan. So in the treatment plan, we're going to do that. We're going to identify and we're going to rank those problems. What's most important, what's long-term, what's short-term, and things of that nature. So we try to keep going with that and make sure that the client is very aware. Then we're going to formulate agreed upon immediate and long-term goals, using behavior terms in the written treatment plan. So we're going to talk about what we're going to do, how we're going to do it, and we're going to actually use behavioral terms, as in we're going to meet the goal, would be met 3 times out of 5 times, SMART goals a week, or we're going to whatever behaviors, we're going to not drink 3 days a week, or we're going to resort to having water 3 days a week, or whatever the case may be. We're going to talk about, a lot of times we're talking about refraining, and we're talking about doing different activities to help refrain, and then also making sure that the individual is getting their therapeutic services in place that will assist them with understanding why they need to be kind of refraining and trying to get things together based on what they want, based on the reason why they came in our program. We're here to help them to do all that. Going to 20, we'll identify the treatment methods and the resources to be utilized as appropriate for the individual client. So basically, we're going to talk with the client about the treatment methods and the resources that we're going to utilize to make sure that they can get to a better state and that they can accomplish the goal they came in here to, put forth and want to take care of. So that's the whole treatment planning area. The second part is excuse me, the second part. The next part is when we're going to get into talking about counseling. So whether it's going to be individual counseling, whether it's going to be couples counseling, significant others, unless it's going to be group counseling, things of that nature, family counseling, and these counseling groups will be there in these counseling sessions will be there to achieve the goals that we just made in the treatment planning area. Is to basically talk about those things, go through those things, be able to figure out what are problems, what are the ramifications of them, examine the attitudes and feelings, and then also being able to consider uh, alternative solutions, different things that could come up, and then decision making. So basically, in um, global criteria starting at 21 through 25, we're going to select the counseling theory that applies. So a lot of times we go with CBT, which is cognitive behavior therapy. We might go with, depending on what's going on, we might go with DBT, dialectical behavior service therapy. So it just really, which therapies we feel most comfortable with, and the ones that we know will address these treatment plan goals that we've just made. And also, depending on who the client is and how you work with the client, you might want to adjust in those ways as well. So you can use more than one. It doesn't have to be the same theory. It could be different theories that you decide to use. Apply techniques to assist the client, group, and or family in exploring problems and ramifications. This happened. What is the result? What is the cause? What is the effect? What happened? Also applying techniques to assist the client group or family in examining the client's behaviors, attitudes, and feelings, if appropriate, in the treatment setting. Next part is individual counseling in accordance with cultural, gender, and lifestyle differences. So being very aware of that. And then also interacting with the client in an appropriate therapeutic manner. Basically, that you are building that therapeutic alliance with that client to have that pretty decent or pretty great client therapist client relationship. Next part, elicit solutions and decisions from the client. So basically, what do you think can help? What can we talk about? What can we explore that might be helpful and can be a solution? Or where do you want to go? What is it that you're looking to get out of this? What would you like to be doing on a Sunday evening versus what you're normally doing on a Sunday evening? What can we come up with? Okay. And then implement the treatment plan. So implementing the treatment plan is the fact that we're moving forward with services, and we're making sure that we are covering all of those goals and all of those interventions and everything while we're working with that individual and providing them counseling. Okay. Case management, that basically is the activity in which bringing services, agencies, resources, and other people together. And that was within a planned framework of action toward the achievement and established goals. So we want to make sure that we are taking those goals serious, and we are able to come to a solution, and that person is able to achieve them. And it's pretty much involve liaison activities and collateral contacts as well. So a lot of times there could be different things that's going on in your life or in the life of a person that can be helpful to have some particular activities to go to, AA meetings, NA meetings, different type of activities, maybe where families go and hang out and do some, some activities with, no alcohol or no drugs involved and things like that. Maybe church activities and things like that. Global criteria 28 and 29, basically coordinating the services for the client's care, checking out with the different agencies and different resources and things of that nature where you can find services for an individual that you can see if they're interested in doing this or doing that. Explain the rationale for the case management activities to the client so they'll understand that there will be some times where a case manager will reach out and say, hey, there's an activity going this week. You might be interested in something like that. I learned about a poetry night, and it's all it's for sober individuals. It's for the recovering population or something of that nature. So yeah, things like that. And that's because, of course, if you would mentioned the poetry event is because they like to go out and have a good time, but they're very interested in maybe creative writing. So, I mean, just I'm just throwing some things out there and throwing some things together. But this is how we typically would go through our cases. Um, Crisis intervention. So those services which respond to an alcohol and or other drug abusers need during actual emotional and or physical distress. Global criteria for that one, recognizing the elements of the client's crisis, also implementing an immediate course of action appropriate to the crisis. And then the next one is enhancing the overall treatment by utilizing crisis interventions. So in the state of North Carolina, we typically have what we call a PCP as our treatment plan, and we typically have a crisis area on there, a crisis basically a crisis plan on there, and that's kind of like where we put everything in. And if you don't have a full assessment or a PCP like that, like what we have here, you can create your crisis intervention part, which is your crisis plan for that particular individual. And it could be things like who you would contact if there's an immediate crisis, what would you do next? You know, different things that they would have in place, whether it be dealing with natural supports, dealing with some professional supports. I mean, whatever they're going to put in place, doing some activities, going out for a walk, taking a run, you know, playing baseball, playing tennis, or whatever the case may be. But things like that, basketball, dribbling the basketball. Those are things that help them in a crisis to kind of help to deal with de-stressing, of course. But then if they feel like they're in a physical crisis or they're in a emotional distressful situation, then they can always, you know, you have the last one, you know, a lot of times it's call 911, go to the hospital. All right. Next part is talking about the client education. So client education basically provisions of information to individuals and group concerning alcohol and drug abuse and the available services and resources. So that's basically keeping them abreast of what is available out there and what's going on that would be helpful to them. Those dealing with global criteria 33 and 34, that's basically presenting relevant alcohol and drug use or abuse information to the client, formal and informal processes, as well as present information about available alcohol and other drug services and resources. So that's in that area with client education. So you're basically just letting them know, you know, what's available, what they could be eligible for. It could be a whole lot of things. In North Carolina, we are doing the full whole person approach. So sometimes it could be information about housing. It could be information about, you know, dental care. It could be information about foot care. It could be information about you having a hangnail. It could be information about ingrown toenail. I'm just using things for example. It could be information about seeing a dermatologist. I mean, so we're just giving the client, we're just educating the client. We're educating them okay about substance use stuff as well, but we're also educating them about things that are going on or things that we feel would be helpful for them, so they'll know that they can come to us, like I said, in a state where we are looking at the whole person versus, you know, just their mental health or just their substance abuse issue or concern. All right. Next part here is talking about referral, identifying the needs of the client that cannot be met by the counselor or the agency, and assisting the client to utilize the support system and community resources available. So this one's global criteria 35 to 39, identify needs and problems that the agency and or the counselor cannot meet. So if we are talking about dental care, we can't do dental care, but we can definitely refer you for dental care, and we can definitely make sure that you follow up with them, and we can also maybe even provide you transportation to get there. Yeah, things of that nature. If you have a probation officer, you got some things going on, but it's stuff that we can't handle, we can refer you out for, let's say if you were having a probation officer with domestic violence also, we can work with trying to figure out another domestic violence agency that you can be involved with and provide whatever supports we can in that scenario. But we can't do the domestic violence services here because we are not licensed in that area. So explain the rationale for making that referral. Yes, we'll explain why we made the referral, and then matching the client's needs and the problems to appropriate resources, just making sure that that's going to be an appropriate match. We wouldn't want to say a domestic violence individual client session with a female with a real huge male that don't like females anyway, and probably would be better in a group setting. He would probably be better in a group setting. Let's do that. So things like that to consider. And then adhere to the applicable laws, regulations, and the agency policy governing procedures related to the protection of the client's confidentiality. So making sure we are doing releases for all this, and we're making sure that we are getting the client's permission to do this referral and permission to release information. In North Carolina, a lot of times when we do a referral, we don't necessarily call someone with the person's name some of the time. Sometimes we do, sometimes we don't. And when we don't, it's typically telling a client, especially substance abuse clients, we'll tell them, you have to show up front and center. I've called them and told them I have someone coming from the emergency room or coming from wherever we are, but you still have to show up front and center. Okay. You got to show up and talk to them. They will not do a over the phone passing information. They will not do any of that. You have to show up front and center. You have to present, is what we tell them. So a lot of times that's kind of where we are in that area. And then 39 is assisting the client and utilizing the support system and community resources available to them. So like I said, trying to help them to get back and forth, maybe transportation. We can make those calls to kind of say, hey, blah, blah, blah. But again, a lot of times it's confidential. So we're just trying to say, did anybody come by from the emergency room yesterday? Yeah, something like that. All right, next one is report and record keeping. So report and record keeping, pretty much charting the results of treatment plan, writing the reports, progress notes, discharge summary, and other client related data. So basically in this area, global criteria 40 through 42 is basically preparing your reports and relevant records, integrating available information to facilitate the continuum of care for the person. So basically, you're putting everything together so that there can be a report that is utilized to make sure that that person is getting continued care and they are able to kind of move forward in steps that we have for services, or stepping down in services, or whatever the case may be, if they have to go to other agencies and things of that nature. We want to have a report of all the stuff that has been done, that's putting together your assessment, putting together your treatment plan, putting together your reports, your writing reports, putting together your progress notes, putting together discharge summary, and then other information, collateral type information that you're receiving, or other documents you're receiving from other agencies. The chart is pretty much ongoing information pertaining to the client, and then also utilizing relevant information with written documentation for client care. So making sure that we are, and we have things kind of lined up for this client, and we're not just dropping them high and dry. So basically, a lot of time I tell people there should be an aftercare plan. There should be some things that they can do after they're done with our service. So the aftercare would have those resources in different places that they can follow up with, and things like that. Last one here is consultation and other professionals in regarding the client's treatment services. So related to in-house staff and outside professionals to assure comprehensive quality care of the client. So basically, global criteria 43 to 46, recognizing issues that are beyond the counselor's based knowledge and or skill, consulting with appropriate resources to ensure the provisions of effective treatment services. 45 is adhere to applicable laws, regulations, and agency policy governing the disclosure of the client identifying data. And then 46 would be explaining the rationale for the consultation of the client if appropriate. So basically, this is where we are going to try to work with, let's say the person came in and they were a substance abuse individual that was dealing with probation, parole, and had some court stuff as well. This right here is a good setup. I used to be a probation officer, so we did a lot of this right here. Consultation with those providers and making sure that that person has made their sessions, getting all that report stuff from before, and then making sure that we're able to follow that person and make sure they're able to get more care that they need moving out of the program that they were recommended for and that they did, and that they follow the recommendations of what the program is saying they need to be doing next. So that's a lot of what happens. And so if they have to go from one program over to an anger management program, then we're going to make sure that that's something we did. And as a probation officer, we collaborated with the counselors. And as a counselor, I collaborate with probation officers, also parole officers, to make sure that these different services are able to be put in place, and that the treatment plan that we have was actually completed, everything was achieved, the goals were achieved, but there are some other things that need to be dealt with also. So a lot of times, I'll give you an example. If a person comes into a substance abuse facility and they need services, but they tell me right now they're suicidal, first of all, they wouldn't even be able to stay. They would not be appropriate for an intake right then. They need to go to the hospital and get a clearance that they're not suicidal for us to kind of keep them in our program and keep moving forward. So that's kind of one of those things. And so let's say a person's leaving services and they're feeling kind of like, okay, I haven't had my medicine, blah, 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 or whatever. We would want to make sure that they follow back up with their psychiatrist. We want to make sure that they follow back up with their therapists in the community. We want to make sure that they're able to follow up with, sometimes we want to, work with family and make sure family knows that they have to go to see the doctor. They have to follow back up with care. They have to do this, that, and the other. They have to go get their blood pressure checked next week. They have to go get their cholesterol checked. They got to go get their diabetes checked, so different things like that. So we try to, definitely work with individuals and explain the rationale for this. If you don't get your diabetes checked, it might not be a good look in a few days. So, we try to explain to the client what's going on. We try to give them great consultation as to what's next and what they can be doing, the appropriate services, appropriate resources, appropriate things, and then try to create that collaborative team around them, that everyone kind of plays a role in trying to make sure that they are getting some of the good stuff that they need in order to be successful. So again, this is the 12 core functions and the 46 global criteria. I wanted to just go over this briefly because, like I said, this was something that definitely we utilized getting our full licensure in the state of North Carolina back in 2008. My class of individuals that got their license, we were the last class that actually sat for the oral boards, and then they placed the oral boards within our testing. So the oral boards went away in 2008. So I did have the experience of sitting and putting a full case together and putting my case in front of the board, and again, getting scored on that. And they made the decision whether I was eligible to have my license or not. So with that being said, I just wanted to share this information. I am hoping that anyone in any of my courses are able to use this information. Anyone who's just looking for information on substance abuse, I'm hoping you're able to use this information. But this is just a basic overview of, again, the 12 core functions and the 46 global criteria. This is, again, Dr. Latasha McElwain, and I appreciate your time. Thanks for listening.